Hey guys, Dr. Better here, physical therapist, and my wife, Michelle.
Hello there.
And today we want to talk a little bit about slumped posture, rounded shoulders, forward flex posture. Maybe you guys have a protruded chin. I just had a patient today who has this, and it got me thinking about doing some videos for her. I'm going to give a shout out to Lou, because I told her to watch this video later on. And it's just some things that we really work on to be able to help to pull the shoulders back, strengthen the muscles more posteriorly, stretch some of the muscles up in the chest to start helping the shoulders back into proper alignment. So proper alignment really is, what you're going to notice is your ears should go straight down through your shoulders on down. It should be a nice little plumb line. But what happens is we kind of get rounded. We a little bit forward like this. We want to get pulled back a little bit. Sometimes our chin can stick out. We want to be able to bring it back right there. So we're just going to give you some exercises that are going to be able to address that. And Michelle's going to assist with me on this. So we're going to start off in sitting. Michelle's going to take a seat. So the first thing we can start doing when you guys are sitting at your desk, when you guys are just more cognizant of the fact that you guys want to bring your shoulders back, is act like there's a board right here between your shoulder blades, and I want you guys to pinch back and hold it. Right? So what this is doing is we're going to be contracting some of the muscles back here. We're going to be contracting middle trapezius, rhomboid major, rhomboid minor, and we're strengthening those muscles to try to get us back. And what we're also doing is we're starting to stretch some of those muscles up in the chest a little bit, up that are attaching up into our shoulder, and start to put those a little bit on stretch and strengthen these muscles. So you guys can start there. For some of my patients, honestly, this is going to be a good place to start. We're not going to do any actual resistance training because they can't handle it yet. We're just going to start off with these scapulothoracic pinches. We're going to go from there. Now, a good stretch to do in sitting is to stretch the pectoralis minor muscle. Now, pectoralis minor is going to be actually inserted up here on the coracoid clavicular process, or coracoid process near your clavicle a little bit. And so the pectoralis minor is going to be a muscle that goes from right there on that point. It's going to insert down on the 3rd, 4th, and 5th rib. And so what we can do to stretch that muscle, if you guys have someone that can help you, is you just get in a chair and you want to pull back. You want to pull back, and you start feeling that stretch right up in this area as you pull back. Don't pull back too much, right? Don't necessarily need to stick a knee into them or anything like that, but just have a nice stretch right there. And you guys want to hold that for as long as it's comfortable, but I like to do 60-second increments and be able to go up from there. Another thing you can do to really start to alleviate some of the pressure that pectoralis minor is putting on a patient or on yourself is you can start massaging right in this area right here. It's going to be pretty sensitive. There's a lot of pressure that's built up on that small little knot right there, and that small little bone, that coracoid process. But you can kind of massage it. It's going to feel a little bit, probably about as big as a skittle, right in that area, and massage it nice and evenly. Not too much. Listen to your patient. Does that hurt?
Good.
All right, so we're good to go. So after you guys do that for a little bit, we can go ahead and we can stand up. Let's get the chair out of the way. So we want to stretch pectoralis major. Now, pectoralis major is a pretty big muscle. It's your chest. What a lot of people don't know is that there's 3 main fibers that make up this muscle, and those fibers are going different directions. So there's actually 3 stretches we want to do. Michelle's already in the first one, so you're gonna have your arm nice and high. You're gonna kind of rotate in a little bit, and you're gonna put it on stretch. Now, the angle that she's at right now, for pectoralis major, this muscle fiber is gonna be more going towards the costal muscle fiber for the pectoralis major. Inserting down sternum and also costal, so more ribs, and then going up and inserting back up right there on the humerus. So you guys are going to hold that. We want you guys to hold it for, again, 60 seconds preferably, but you guys can break it up and then keep going. If you're over the age of 40, you guys want to stretch for at least 4 minutes cumulative time. And then go into the next one, which is going to be straight across. Now we're hitting more of those sternal fibers at the pectoralis major. So nice stretch. You guys are going to feel it right across, right in there. Again, stretch, at least 60 seconds, break it up if you need to, and then we're going to go nice and low. Nice and low. Now we're going to get into more of those clavicular fibers. They're going more from the clavicle and down. We're going to get that nice stretch. You guys can feel it higher up in there, nice and stretch. Stretch those muscle fibers. Good. Now after you're done with those, really want to focus on working on some of the muscles posteriorly. So a great exercise for this is going to be more of a high row. Now, the key is we don't want to do a low row. We want to do nice and high. So we want our arms to be at 90 degrees. Right here, right? We want to have a nice 90. We want to have a nice 90. And when we pull back, we want to pull back and we want to pinch. You guys can hold it there at the end range of motion to have a nice Nice isometric hold at the end, and then before you're bringing it back, and then pull back. Now, it's really good to use a TheraBand with this. You guys can use machines, you guys can use weights. I do like to use TheraBands because they're very versatile and easy to use. So we have a TheraBand right here. So 90, 90, pull, hold, and relax. Let's do 12 of them. 2, 3, all the way forward, and all the way back. 5, 6, keep going all the way back, pinch. 8, I made it hard for her. It's a heavy TheraBand. Making her get a workout in tonight. Come on, keep going. 11. One more. 12. Good. Alright, let's relax. So, those are going to be some good stretches, some good exercises. Start getting you guys to bring those shoulders back, not having forward flex posture, not having rounded shoulders, and start alleviating some of that pressure that goes up and down on the cervical spine and also in your thoracic spine. So, yeah. Please, guys, ask any questions you want in the comment section. Please, if you made it this far, like the video and subscribe. And stay tuned for some more great videos. Have a good one.